Thank you for having me. It's great to be here with so many of great minds in drug policy and research. Thanks to Tom here, obviously for the great work and intro and the leadership at the Global Recovery Initiative Foundation. I also want to thank you, Dr. Barthwell, and special hello to Assistant Secretary Delphin Rittman, my friend, and Dr. Volkov, and Dr. Koob as well, and of course, Dr. Kelly. As you know, the Office of National Drug Control Policy, which advises the President on drug policy and develops the President's strategy. We also oversee the drug-related programs and the $40 billion budget of 18 federal agencies that work in the space, spanning both public health and national security. As a practicing physician, I've been able to work in large cities of 25 million people and rural towns where folks often paid me with fresh apple pie and homegrown tomatoes. I've been fortunate enough to treat so many patients with substance use disorder who have gone on to lead successful lives in recovery. But I've also seen so many times in my ER shifts where I reverse an overdose every single shift for months at a time. And unfortunately, I've also had patients succumb to their disease. I've attended far too many funerals. So when President Biden asked me to serve in this role, I was eager to do so because we have a real chance to make a difference. We were just celebrating yesterday with him the Inflation Reduction Act at the White House here, and it was a reminder that we've lost more than 108,000 lives. We just saw the data today just come out for 12 months ending April of 22 that shows losing over 108,000 lives. Now that's an American life lost every 5 minutes around the clock. And right now we're in the most dynamic drug supply environment in our nation's history. We're seeing increased overdoses from synthetic opioids like fentanyl, meth, as well as cocaine. Now, with the rise of these synthetic substances, a Pandora's box has been opened. We know that these substances ultimately infiltrate into our most vulnerable communities, and it's really been unraveling the very social fabric of our nation. And what I've seen is been destroying, and you've seen, destroying American lives and livelihoods. So, in so many ways, we're living in historic times. And President Biden and this administration were taking unprecedented actions to meet this moment. The president made it clear and an important part of his unity agenda for the nation earlier this year. And he is committed to addressing this epidemic and saving lives. The mandate from him is clear: reduce the number of drug overdose deaths, put quality public health services within the reach of people with addiction and substance use disorder, and stop the drug trafficking organizations that seek profits by harming Americans. And that's exactly why the inaugural drug control strategy, which we sent to Congress early in April, is designed to first save lives and to make sure people have the services and support they need. And for the president, for myself, saving lives is our North Star. So the question really becomes how do we do it? The strategy really looks at two major drivers of this epidemic. One is untreated addiction, and the other one is drug trafficking profits that are fueling it. So it really prioritizes 4 near-term actions that we can take right now to meet people where they are and reduce the overdoses right at this moment. So I'll just go through them a little bit. The first one and the most important action we can take to save lives right now is to have naloxone, the opioid overdose reversal medication, in the hands of everyone who needs it, without fear, without judgment. Especially today when 3 out of 4 overdose deaths involve opioids. Now, harm reduction interventions like naloxone allow us to work with people who use drugs to build trust, to build engagement, and keep folks alive. I've seen it work, and it has bipartisan political support. So we're going to expand access to naloxone, which is also a cost-effective tool, and it has the most potential to save lives right now. Second, the president's strategy lays out actions to tackle a long-standing issue, which is the fact that fewer than 1 out of 10 people who need treatment are able to access it. Now, everyone who wants treatment should be able to get it, and that's going to be our goal. Through the president's strategy, we're going to double treatment admissions for populations most at risk of overdose death. And we're going to work to ensure universal access to medications for OUD by 2025. Because the bottom line is this: if it's easier to get illicit drugs in America than it is to get treatment, we're never going to end this crisis. Third, the strategy is unveiling a renewed focus on disrupting transnational criminal organizations and their illicit financial networks and supply chains. It's actually going to focus on where it hurts them the most, their wallets. And we're going to continue to work with other countries and make it more expensive for drug trafficking organizations in every way possible. And the fourth topic is topic at hand. The strategy really ramps up our work on data and research. At a time when the federal government faces large gaps in data collection and analysis related to drug policy. Let me give you an example. We know that the best predictors for a fatal overdose is a prior non-fatal overdose. Yet, I'll give you the example of Maine. The state of Maine, for every one fatal overdose last year, there were 14 non-fatal overdoses. And that stretches the healthcare system every time. But in too many parts of the country, we don't have a consistent or a timely measure of non-fatal overdoses across. Now, that limits our ability to identify emerging trends and act before it's too late. So the sooner we can get comprehensive real-time data, the sooner we can use it to drive good policy decisions. So we recognize that science should drive policy, and that's exactly why it's one of our top priorities. And this directive comes from the top. Just 7 days after taking office, President Biden signed an executive order prioritizing science and integrity and evidence-based policymaking. And it's a priority for me and everyone on my team here as well. In fact, I'll tell you, right now after joining ONDCP, I reorganized this office to create a new Office of Public Health, as well as a new Office of Translational Research that's now headed by Dr. David Holcrape, who's a former Dean, School of Public Health. He's also a former CDC employee. And as a result of this, we have had great success bringing scientists to join us on short-term assignments. We're also trying to lead the administration-wide effort to address gaps in non-fatal overdose data to make sure that health inequities are factored into substance use data systems. And we have developed a national drug data plan as asked for by Congress to accompany the National Drug Control Strategy. I'll give you another example. We're working with the Department of Transportation, the NHTSA, or the National Highway Transportation Safety Administration, to develop a dashboard on non-fatal overdoses. It uses actually a first responder data, as the 911 data, so that we can better understand the patterns of these poisonings and identify service gaps that need to be filled for people who experience non-fatal overdoses. So whether it's the amount of time that EMS takes to respond, or the amount of overdoses, or the cluster of overdoses. All those things are important, and we can learn that from NHTSA dashboard, which will soon go public. Now, still there's so much more research to be done, especially when it comes to our understanding of recovery and how these policies can help people maintain recovery. We know how important recovery support services are, like recovery coaching, employment, housing, childcare, food security, and so much more. But there are also things we don't know, such as how effective are different models of peer recovery support services. We also want to learn about what are the different trajectories from substance use disorder to recovery and or to remission. It's something that has fascinated me. We take all paths to recovery, but we want to know which ones are better than others, and then make sure that we are directing people. And we've done this before in so many other medical diseases and conditions. And can we identify, for example, potential intervention opportunities and tailor services and supports to an individual's needs. How can we measure recovery? Can we measure recovery capital at a family level, at community level, or are there other levels at which we can measure those? And how can recovery capital measures inform services and supports? So that's actually my request of you. Help us understand what research needs should be prioritized to inform policy, to inform practice, and to help more people achieve and maintain recovery. Because this is in turn will help us reduce overdose deaths and build healthier, more resilient communities. You know, in his State of the Union, the President called out the 23 million Americans in recovery. It's a call out for action, for more research, and making sure that we have the resources available. And in this recovery month, there's no better time. So now is our time to act. Because to me, it boils down to one simple question. As leaders in our communities and across our country, what legacy do we want to leave behind? Do we want to be the next generation and to look back that saw how stigma or gridlock stopped us from taking the necessary steps to save lives? Or do we want to be remembered as leaders who ushered in a new era of compassionate, data-driven, and high-impact action? Now, I promise you, I'm going to do everything in my power here to save lives, and I know I can count on you to do the same. And as mentioned, you know, in his 2022 National Recovery Month proclamation, the President Biden's reminded us that there are so many pathways to recovery. He also called on us to take on stigma that affects so many millions of Americans with or in recovery from substance use disorder. And it casts a shadow across our efforts to address addiction and support recovery. So on behalf of President Biden and myself, thank you. Thank you. Thank you for the work you do every day to build our knowledge and help individuals, families, and communities across America thrive. Thank you so much for having me.